AMAZE TV for inviting me to speak on the conspiracy theories around COVID-19 vaccines this evening, and also the importance of having your vaccination. My name is Isaac Green. I am a practice manager, manage a medical center, and I have done so for over 21 years now. I've also managed COVID vaccine centers. I understand that this program is being funded by the Community Fund this evening. So I would like to firstly base my discussion on two main topics. Firstly, looking at the conspiracy theories around COVID-19 vaccines, and also how important it is to get vaccinated. So I would like to, introduce you to my guest this evening, Jibril, who has got a lot of conspiracy theories around COVID-19 vaccines, and would like to hear from him, and then have an open discussion about COVID-19 vaccines. So Jibril, tell me, have you had your vaccination yet?
Afternoon, Exeter. Well, no, I have not had my vaccine yet. And I'll tell you why. I do have some underlying health conditions, such as I'm diabetic, and I also have the fear of it. I've never been vaccinated of any sort of vaccination prior in my life. And apart from my diabetism, I believe that I'm looking after myself, and I haven't had any sort of viral circumstance lately, like catching a cold or anything like that. So I've been maintaining myself, and I'm quite healthy. So I've always thought, but why do I need a vaccine? And also, lucky for me on my side, I do not know anybody that passed away from COVID-19, or have been diagnosed having the symptoms of the illness. So so those circumstances always brought me away from the vaccination. And also, like you've mentioned it earlier, is this factor of conspiracy theory. It's not just coming from me, but I believe we have millions of people who believe that we can continue our lives and move on from this issue of COVID-19 without being vaccinated. Lately, they're promoting, I've seen online, a lot of people are promoting a healthier lifestyle where I believe that also helping to maintain and sustaining life. But I, on the other hand, when you look at the figures from the government, we understand that we do have a problem. And also knowing that vaccinations are supposed to help, I'm wondering whether I'm on the right road of always say no to the vaccine, and I just want to find out more, more informations, and trying to help the Black community as well on making a better decision whether they should take the vaccine or not the vaccine. But myself, I'll be honest with you, I just don't know, because a lot of things are happening.
So what is this conspiracy theory? Can you tell me a bit more about it?
We could write a massive book, or even make a movie out of it. It's so many conspiracy theories, starting from Bill Gates, who wants to minimize the population. Then you have, at the moment lately, you have issues with Dr. Fauci, for example, who's getting, who's on the trial at the moment. And apparently you have stories that the COVID-19 generated from a lab in Wuhan, which was financed by the same people we are talking, Dr. Fauci, Bill Gates, and so on. So it's very difficult because millions of people are talking about it. We have hundreds and thousands of videos about it. So it makes it very difficult for someone like me who has an open mind on different opinions whether I should take the vaccine or not. And another thing as well is this new sort of competition on TikToks where you see a lot of people using a metal coil or metal coin and placing it on their arm where they have had the vaccine, and it seems like it's turning these people magnetic. So it's like I've seen several videos where people are putting coins or even certain tools. So, one lady from Britain actually, she showed us that she's put a piece of a tool here, a tool that you take to take out the screws. So she placed it on her arm and it stays stuck. And it's obviously it's a metal piece. And then she took the same piece and she placed it on her forehead and it stays there. So obviously once I saw that, I started feeling, oh no. So you understand me. And that video came out just at the time when I was thinking of myself I was changing my mind about the vaccine and thinking, okay, I need to go for the vaccine. And once I saw that video, well, then I withdrew myself. And
so can you demonstrate to me exactly what happened? I have had both doses.
Oh, you have had both doses?
I have, yes.
The only way I can demonstrate is by using a coin or a coil. I mean, would you mind doing it live?
Not at all, yeah.
Oh, okay. I haven't.
And I've got some magnetic properties.
Okay.
On my skin because of the vaccine.
All right. Well, I have the key here. Okay. We could try. I don't know if it would work, but let's see. Which had it on the side? Yeah. Right. My conspiracy theorist. Here comes the moment of truth. So, was it where about was it?
It's around there.
Okay. All right. And I tell you, I've done that to a friend of mine, pretty close, and he has had AstraZeneca. And
Had AstraZeneca
as well, yeah. And it glued on him. But on your arm, it seems like nothing is happening. All right.
Well, there you go.
Too bad for wait. It's too bad for the conspiracy theorist.
So they're just conspiracy theories.
May I try again? Wait,
Yeah.
let me go through certain areas. Right, guys, conspiracy theory debunked. What can I say? It didn't know.
I mean,
what.
it just shows these are theories. I don't know where they come from. The vaccines, they have been tested, and well, you know, the population has been vaccinated. So obviously they're safe. They've gone through clinical, you know, safety measures, and that's why they are being, you know, rolled out to the general population. I think it's come across, and we're all aware that a lot of people from the Black, you know, Asian and minority ethnicity group, you know, are not having the vaccines. I mean, well, for instance,
but I'm not. Excuse me for cutting you out, but I'm not yet convinced. I mean, we are talking about your case. You have had AstraZeneca, right?
yes.
Okay. There's other vaccines as well, such as Pfizer. So we Moderna. Some of these vaccines have shown to give certain side effects to people. Like yesterday, I saw this video of this lady that has what we call Bell's palsy. So one side of her face has become paralyzed, and it's several of them. So this is, you see what I mean? I am now a bit reassured because yesterday I've done the same test to a friend of mine. And I'll be honest with you, using the same key, and it unfortunately is not here now, but it glued onto him like a magnet. Then I've placed the same key on his other arm where he did not get the second shot, and it glued on him as well. So you see, it's very difficult now. And now I see that you seem to be normal, thank God.
Yeah. Well,
You are not magnetic.
I've had both my vaccines,
Yeah.
AstraZeneca,
Yeah.
just guide the key, and
Yeah.
there's no magnetism, there's
Yeah.
not magnetic,
Well,
properties on my skin. So, I mean, have you ever tried to look at data on the gov.go,
Yes, I've looked into the .gov data,
Yes.
but again, I wish I could. I hate having to sound like that, but I'm still of a conspiracy theorist, so you'll have to forgive me. But I'm wondering, are the data from the government correct or not correct? Because on the other side, it's not just me that believe in these conspiracies. Let's look at the side of the country America, for example. You have Dr. Fauci on one side, but you have also one side of his government that are taking him to trial because they want to find out whether everything he's saying is true. Do you see what I mean? And there's obviously, for them to go through that step, is because there's obviously certain issue that's not quite right, if you see what I mean.
Yes.
So they want to investigate in that.
But
So-
I mean, the thing is, as I said before, I've managed COVID vaccination center,
Yes, yeah.
and for about 3 months. And during, my, obviously, I led the whole center during the vaccination programs, and we vaccinated about, hundreds of patients a day. And while I was there, I only did weekends as well, I didn't have any emergency at all. Nobody collapsed. We didn't have to call an ambulance, and so this is both with Pfizer vaccines and AstraZeneca.
So no one has returned to you saying they have had some kind of side effect after the vaccination?
Well, I'm just talking about the actual COVID vaccinations.
Okay.
The vaccines, and then they go away. Obviously, if they have any side effects, we're probably discussing that with their GPs. They don't come to the center. But what I'm saying is, at the point of vaccinating, patients, and hundreds of patients, while I was managing the center, we never had a single emergency. So, I mean, these conspiracy theories are just, theories. I think most of them are made up by people. This is what I believe. And if you go to the .gov, website, and you're talking about the data there, I can assure you that there's no way they're going to publicize, data that is not accurate. There are lots of deaths, lots of people have died from COVID-19, and we understand from the information that's coming out now, the data is coming out, that, for example, if you have the AstraZeneca vaccine, you've got 95%, chance of not being, as you said, in a hospital, not having any serious or severe, side effect from it. And I think we need to look at, the data and the information from the right, correct sources. Go on the .gov website. They update that website regularly, and this is, mostly technically data that comes, real data that comes from COVID vaccination centers and other, centers that actually vaccinate patients. So it would be best to base your research around. I think we're lucky in England, whereby a lot of research has been carried out, around COVID-19. And we can see now that because more and more people are getting vaccinated, cases are dropping, which means it is actually working. So I'll be honest myself. Initially, I was a bit skeptical because I wanted to see more data. And then, as soon as we start having a lot of, published data, I was able to make my decision that actually this does work. And, I think we should be aware that we individually and collectively responsible, to ensure that this pandemic comes to an end. And if we're not taking our vaccines, then, it will fluctuate like that. We'll have lockdowns on and off. And, the thing is, we can't complain about lockdowns if we're not having our vaccines. So, I mean, what have you got to say?
Well, I don't know. I mean, it's very difficult. I mean, because as I'm saying, you have had the vaccine, but as I'm looking at myself as well, I just can't really forget what I mean the visual. So the fact of having seen those videos, I know that my research on the issue has not been the one of a scientist, but it's more likely of someone who stands back and watch what's happening. So I'll give you more like a spectator. So I'll give you an example is I'll be listening to reports of whoever has had it and make a judgment out of it. I give you the example of one of my friends where he has had the AstraZeneca on one arm, and the next, I mean, on that evening he came, I went and visited him at his home, and he wasn't feeling too well. But at the same time, obviously he's my friend, so we started joking around, and I said, oh, I've seen this video about the magnetism, so I tried it on him, but it did work, and myself, I do have a video of it on my phone. So that's why I was kind of shocked that with you it didn't happen. But again, the conspiracy theorists, what they are saying is that the world is dividing people in a sense where they're saying that some of the vaccination will keep people alive and some of it is made to kill some people. So it's very difficult for me to know where I stand now, but I'll be honest with you, I really want to stand for our government. I really want to help our population. I want people alive rather than to be dead. I'm myself a father, so I have to also find out the right decision whether my children must have it or must not. But a lot of children are fine right now, even without having the vaccine.
Yeah. Well,
So that's why
there are actually reported side effects, from the vaccine, as with any medication or any, vaccines. There will be side effects. But what you take into account here is that it's safer to have the vaccine because then you don't suffer. If you do then contract, COVID-19, then you have a higher chance of surviving it.
so you can because obviously after this program I'll be going home with lots of thoughts.
Yes.
So would you actually say it's been researched and they can actually assure that taking the vaccine will get rid of COVID-19?
Taking the vaccine will protect you from having a serious effect if you do contract COVID-19. It doesn't mean that you will never contract COVID-19, but it will not get severe where you may need to be admitted in the hospital or something like that. And the thing is, it's very important to keep ourselves safe and protected, and the people around us as well.
So shall we say that COVID-19 has sort of become like the new flu? Is that what it is?
Well, I don't know about that.
Yeah.
That's not my background. But my understanding is that it will continue to. The vaccine will continue to be rolled out every year as a booster. So usually people who've had their first and second doses may have, an annual dose just to boost the immune system. That's what I understand.
Yeah. So the government has reported lately less deaths on COVID issue. Obviously the country has sort of reopened as well. We're still mandated to wear a mask. So I'm wondering, do you think this is due to the fact that people have been more people have been vaccinated, so it's stopping the chance from COVID to be passed on from one person to another, to the next, to the next? Do you think that's what
Yeah, so because
slowing it down at the moment?
yeah, I believe because more people are vaccinated now, they're not suffering or adversely from the actual virus itself. And, people can still transmit it, even if you've had your vaccination. So you still have to continue doing the same thing, washing your hands, sanitizers, mask, and social distancing. The only the benefit, obviously, of having a vaccination is that you will not get a severe side effect from it. But then we have to think about people who have not yet been vaccinated. So somebody who may contract the virus may not suffer any side effects from it, but can transmit the virus to somebody else. So we have to, continue to protect our, society and our community. Now, yes, so it's clear that because more and more people are being vaccinated, especially having had their second doses, cases are now falling, and not a lot of people are contracting the disease, the virus. However, we just have to take into account as well that there are new variants coming out. For example,
A new spike protein.
Exactly, the Indian variant. So we shouldn't get, too relaxed. You should still, even if you've had your first and second doses, you should still, be following government guidelines and protect.
No, I do. Yeah, I do.
I mean, do you think about the possibility of, say, for example, you contracting the disease, not suffering from it at all, and then passing it on to your family, your children, members of your family, friends?
Yes, I thought about it. Don't get me wrong. I do believe, I mean, I've been on Earth for enough years to understand that the air that we breathe has totally changed and is different. There is something out there, I don't know what it is. There's definitely a spike protein. I can feel it in my throat, I can feel it on my nose, I can feel this. But the way how I conduct myself is in such a way so that so far, thank God, I've managed to always clear it out. I don't know what I'm doing. Maybe it's because I'm eating in a correct manner, whatever I'm doing. But even in terms of my family, there have not been sufferers. Although my parents also, they are of an age group where we would say they are vulnerable, but thank God they have been okay. And luckily on my side, like I was saying, despite the spike protein, the Indian variant, the South African one, the one from Guatemala, or I can't remember which one it was, wherever it's coming from, so far it has not hit me or my family members, and I thank God for that. The only thing is that, like I said, I do believe that there is something out there in the air and that we need to be able to protect ourselves from it. I am still a bit suspicious whether the vaccine is the route, but like I said today, you've showed me something different which I didn't see before. By using this key and putting it on you, it did not glue on you like it glued on other people online or my friend. So it's putting me now back in a circumstance where I'm thinking, okay, well, I don't really know what to do, doctor.
Well, I'll go back to the old saying, prevention is better than cure. So yeah. I understand you saying that none of your family members or friends been affected by COVID-19. So the important thing to know is that it's better to have your vaccines when you're well, because once you contract the disease, then it'll be too late to have the vaccine.
To act against it, yeah.
And then somebody could suffer from it very severely and end up in a hospital. And we are all aware of the consequences could be, fatal.
Fatal.
So it's the best time to really take action when you are well and stop the spread of the virus.
Okay.
So what do you intend to do moving forward?
That's the hardest question. Moving forward, what do I intend to do? Well, I will sit on it for now and think about it. Probably make more research of it and see what the government are offering. But obviously, I would like to tell my black population, I mean, the choice is yours. I cannot grab you guys by the hand and tell you go get vaccinated. You will have to do your own research but in the past, from what we have known from other vaccines helped the population. There's always a situation where there's someone that might not respond to that particular vaccination. Obviously, we are all different. Our immune system responds differently. Some of us are stronger than others. Some are more resistant and some are not. So that is only about what I believe your own personal luck as well. But yeah, I mean, I just wish we went into that situation. So it's very difficult for me to even now as I'm speaking to you, it's difficult for me to even know what step I must take now, what action I must take now. But so far, if you see me coming into your station and having this interview with you, is because yes, somewhere I am in two minds about it, whether going for it or not, so.
Well, the information is there. If you go to gov.uk, there's lots of information. Approximately 39 million people have had their first and second doses.
Okay.
And of that number, only 1.5 million are from the, Black, Asian and minority ethnicity group, the Bame group.
So we're the ones left.
So, yes.
Yeah.
So
Okay.
I think collectively people have got to think more about, having a vaccine to support, the community and, support the, hopefully, closing down of the pandemic. And if we don't have the vaccine, the pandemic will continue. Well, thank you very much. I hope that you will look in the right places and stop looking at those conspiracy theories that puts you off having your vaccination. So go out there. If you need more information, search in the right places and get vaccinated.
Okay, thank you, doctor.
Thank you. Thank you very much for coming today.
Welcome.
Jibril.
Thank you for having me around.
I hope that our Black Asian and minority ethnicity group will please think about having yourself vaccinated. The vaccines are safe. There are data out. There's enough data out there now. And if you've got any personal issues, any health concerns that you're not sure about, you can go to gov.uk website and do research on that. And if you can't find your answer, you can still check with your GPs, your general practices, and they should be able to support you and guide you in the right direction. Thank you very much for listening. Thank you.
Bye-bye.